I'm Dr. Preeti Sarvadekar, practicing dermatologist in South Mumbai for the last 18 years. Today I want to share something about hyperpigmentation. Now, hyperpigmentation is very common amongst a lot of women compared to men. However, there are different types of hyperpigmentation which can be seen amongst men too. So let's understand what exactly does it mean. Hyperpigmentation can be either uneven skin tone where the skin looks patchy or unequal in color. You can have blotches on the skin which show up suddenly and they look darker than the rest of the skin. And you can have discoloration which can happen on the forehead, on the sides, around the mouth, and there can be different various causes that are causing this. Once we understand the reason, once we understand why it has happened, our life would be more easier and we would be able to take care of it. Also, it gives us more clarity on whether we need to take treatment, whether it can be handled on your own, whether it needs to be done with some procedures, whether it needs some kind of external help, and also whether if it's not going to go, we don't want to waste your money and you keep having hopes that it will go, but at least if you know, you're more sure of why it has come, what is happening, why is it showing up on your face, you'll be able to take care of it better. So the most common cause of hyperpigmentation is sun exposure. Living in a temperate or tropical climate, we get a lot of sun exposure on our face, and that can lead to a lot of tanning on the skin with skin type 4, 5 and 6. You can have freckles on the skin which show up around the T-zone. You can have pigmentary demarcation lines which come usually around the eyes, and they show a total like a tricolor difference on the face. And then the most common pigmentation that is seen is melasma. Melasma is nothing but dark brown patches on the cheeks, on the malar area, and it is also known as the mask of pregnancy, or it is known as chloasma, and this is normally seen in women more than men. Women land up getting these patches after pregnancy because there is a hormone change involved. They can also get it with a lot of stress. It can come with a lot of oral medication where they have to take it over long periods of time, and these tablets could be the oral contraceptive pills very commonly. You can have sulfonamides, you can have hydrochlorothiazides and tetracyclines, and of course isotretinoin. Now these medications are photosensitizing in nature and make your skin more sensitive to the sun, and hence we'll end up getting pigmentation from medications. So understanding where it has come from is very important so that you can treat it accordingly. Now there are certain triggers which can actually make this pigmentation suddenly come up on your skin. So when somebody is going through a hectic lifestyle and suddenly there's a loss in the family, sometimes there's pregnancy, and sometimes there's a lot of sun exposure with a long trip, or suddenly you forgot to put your sunscreen one day and you were out in the sun for a long time. This is when these triggering factors can land up giving you pigmentation on the face, and you would wonder that I never had this before, but suddenly it's come up, and how did this happen? Of course, the people who commonly get it are the ones who have it in the family. It's an inherited trait or it's genetic in nature, and therefore if somebody in the family has it, you are expected to or bound to get it. So it's important to understand how you can prevent it, because I'm sure you don't want it to come on your face when you know that your sister, your mausi, your mama, your auntie has it in the on their face, and we know that we want to make sure that we don't get it. Now once we have acquired it, it's important to understand what treatments are available. Either if it's an early phase when somebody sees it coming up and you immediately take help from the doctor, there are topical creams available which can be tried, and they help to reduce the melanin pigmentation on the face. It reduces the melanocytes, it reduces the discoloration and the pigment cells, and you can see it getting lighter and very much under control. However, if it's been with you for a long time, then there might be some peels which you have to do, glycolic acid, trichloroacetic acid, or even lactic acid. And then you have Q-switch lasers, you have fractional lasers, and you have the micro needling radiofrequency treatment, which are all going to be helpful to improve the texture and the quality of your skin and make the pigmentation appear less. However, this pigmentation is a little refractory to treatment. So we must be ready in the mind that it is going to last a little long, and we have to be patient. That's a very, very important trait that we need to have when we've got pigmentation on the face. Also, Indian skin types are not easy to treat because we have sun exposure, our mucosae, the lips, the private parts, we all have dark areas around the eyes, around the mouth and on the corners of the body, and which is why it takes a little long time to heal it completely. However, if you come right in time and if you've been early, you will have a great result.